Hi, good afternoon. I'm Isadora Rangel, engagement editor at Florida Today. And today we're going to be doing a Q&A about vaccinations in Brevard County. We have gotten a lot of questions from readers, more probably than we can handle, but we're going to do our best to get to your questions. We know people are confused and frustrated about how to sign up for vaccines. So we're going to be answering your most pressing questions today. And to help me talk about this, I have three guests with me today. They are my colleague at Florida Today, government editor Dave Berman, who has been covering the county for years. I also have Don Walker. He's the Brevard County government spokesperson, and Jessie Ray. She's the Brevard County social media specialist in charge of the Eventbrite platform that you're using to sign up for vaccines. A reminder that right now only healthcare workers and people ages 65 and up are able to sign up for a vaccine. But Don, Jesse, and Dave, thank you so much for being with me and taking the time to answer our questions.
Thank you.
So two things have surfaced over the past week or so. A lot of seniors having a hard time signing up online, and obviously, as the Brevard County Commission made clear this week, we have an issue with supply. There's just not enough vaccines for over 140,000 seniors who live in Brevard County, much less more than 4 million who live in the state of Florida. But Don, I mean, just so we can get this conversation started, what is the process? When does the county get the doses? Do you have extra doses sitting anywhere? And how fast are you able to get them now and get them out? So you can explain the process to people.
Sure. Well, first of all, the state receives the vaccines from the federal government, and then the governor determines how many vaccines are allocated to the various counties. And so once we are notified of the allotment of vaccines that we'll receive, and we usually get that notification from the state, usually at the end of the week, maybe even on a Saturday. But once we have the vaccines in hand, that's when we open up the appointment process for people to, try to get in and try to get the vaccines. You said there's a low number. I would say there's a scant number of vaccines because we have 150,000 plus seniors in Brevard County who are 65 and older. And as an example, this week on Monday, we received 1,500 vaccines. We opened up on the appointment line on Monday, and within 3 to 11 minutes, all of those appointments were filled, and we did those vaccines Tuesday and Wednesday, and at that point, our supply was depleted. What we do have on hand are second doses that people received appointments for when they received their first vaccine, but as far as first doses, we have diminished that supply, and we're waiting for a call from the governor's office to find out how much and when our next allotment will arrive.
Okay, so currently those second doses are in Brevard County, right? How will people know when they're supposed to take it? Will they get a text alert, an email?
When they receive their first dose vaccine, probably within about 26 days ago or whatever, I think it's a 28-day turnaround, they get a notice from the Department of Health before they leave that day on when their second dose appointment will be. So those who are awaiting second doses already know when they should return.
Okay. And Dave, by the way, jump in whenever you want to, but I have a question about the platform that you're using for appointments, because at Florida Today, and I know you probably have gotten even more emails and messages, a lot of seniors have reached out to us. Their main concern is I either don't know how to use the internet, or people who don't have smartphones, or they're just confused by the text alerts. My understanding is that the state is working on a different system, and Brevard County will be part of it. Can you explain how that new system will work, and do you think it will be more effective?
Well, we know the system is in the works. It's been in the works for several weeks. It's our understanding at this point that within the next couple of weeks, I'd say 2 to 3 weeks, that system will be in place. And from what I understand at this juncture is that it will be a phone system, but what it's going to do is allow people to sign up, and then they will be contacted when the vaccine and an appointment day is available for them to go and get their vaccine. I know they're still working on the system, though, So I'm afraid to say all that emphatically because, things ebb and flow. And until they roll it out, I can't say for sure exactly how that system's going to work. But I believe they're going to implement that in 8 counties just to, work out any of the kinks in the system. And I believe we're going to be one of those 8 counties.
Okay. And Dave, any questions?
And do you expect that that system will replace the current system in Brevard, or will that be in supplemental to the current online system?
Well, ideally, it would take place of the program that we're using right now. Obviously, the goal of the vaccine program is not to frustrate people, and it's not to have them waiting in line, first come, first serve. It's not to have them sitting on the phone hoping someone will answer, and it's not to have them on a computer getting frustrated that they can't get in line for the few number of appointments that are available. So we're working to find the system that works best and can accommodate. But, our emergency management director, John Scott, repeats this often, but it is completely a supply issue. Having the right number of vaccines as opposed to 1,500 when we've got a population in Brevard County of 600,000, and not to mention people who are outside the county that are, looking around at other counties and trying to figure out where they can get the vaccine if they can't get it in their own county. But, if we were getting 20,000 doses a week, the number of people waiting in line to get an appointment would be greatly reduced as far as how much time would be available to make those appointments. Unfortunately, when you're getting 1,500 vaccines, I've likened it to the Beatles coming to town. They've reunited. Everybody wants a front row ticket, and you're one of thousands. Good luck. It's probably, it's supply demand. I hate to use that cliche because that's what it's become, but having the vaccines would solve a lot of the problems we're seeing. If they supplement our appointment program with the state program, it's to be seen whether that's going to be an ample program that can handle the number of calls they will likely get. So I guess we're going to have to play it by ear and see what we're going to do once that system is implemented.
And has the county heard anything about? Has the county heard anything about when supply will ramp up?
Well, here's what we're trying to do to help the supply ramp up. The governor's made it very clear that he wants doses, in arms, shots in arms. And he's even indicated that if he sees where more shots are getting in arms, that's where he's looking when he's making the allocation. So all along this process, we've been developing ways that we can expand this out into the community and accommodate more people who can't get to the central location in Brevard where the Florida Department of Health office is here in Viera. It's a 72-mile long county, 22 miles wide. We know it's not convenient for everyone to get to central Brevard. So one of the things the commissioners did this week is they've approved the county working in partnership with the 3 hospital systems, Health First, Parish, and Steward, to use their offices and their staff to help get shots in arms. And they've also approved the contracting with a private vendor who can help us get shots in arms. And it would really take the number of shots we're able to provide, which we're doing now, 800 to 1,000. It would allow us to do as many as 18,000 to 20,000 in a week. So we've done that so we can demonstrate to the governor, we've got the manpower, we've got the facilities, we have the logistics in place to get more shots in arms. So hopefully that will filter to the governor's office and the number of vaccines that are headed our way will ramp up drastically.
Dave, I believe you had a question.
Yeah, I wanted to ask Jesse, earlier we were discussing what some tips for people in the public that really want to get on the vaccine list, going online and frustrations. What are some things that you might recommend to them that might give them a better chance to actually get one of these appointments that are pretty hard to get right now?
Sure. So, as Don mentioned, we have the text alert system, and other ways of reaching out. So definitely sign up for text alerts. That's going to be the quickest way for people to be notified and to be able to get to the website. And you can do that by texting the one word, Brevard EOC, just that word, to 888-777. And that's going to sign you up for our text alerts. And that we will send out the URL for those appointments. And it's very simple from there. You just click and it takes you right to the site. We also had a suggestion that if you download the Eventbrite app onto your phone or your mobile device, you can kind of pre-populate your information into that app. And then when our new appointments come available, you can follow us on Eventbrite and you will get notified through Eventbrite when we have new appointments available or a new event happening. And then that way, when you go to sign up for your ticket, it just automatically populates all of that information that you've already put into your Eventbrite app. So your name, your email, your phone number, it just makes the sign up process a little bit faster.
And Jesse, while we have you, we've gotten a few, may I say, technical questions from readers, and I'm going to read them to you. And I'm sure many seniors are having the same issues. So I got one from Constance Cordova. She says, my question has to do with the refresh aspect of the different pages in both the public side, which I know you guys don't handle, and the Department of Health site. That's the Eventbrite one, I believe. Is there an automatic refresh for 1 minute? Is it wise to let it run, or better to refresh more frequently, like 15, 30, 45 seconds? So I'll ask you, there's more questions, but I'll start with that one.
Okay. So yes, definitely refresh just to see. So ultimately what happens is we set it up so that people have about 30 minutes to register for the event. It shouldn't take that long, but the system, if you haven't completed your registration in 30 minutes, it will kick you out. And so if you're refreshing every few minutes, if someone has been kicked out of the system, or if someone realizes, oh, wait, I'm not a healthcare worker, or I'm not 65 and older and I don't qualify, they may back out of the system. And so by refreshing on the wait list, you might have a chance to be able to get into the ticketing process. However, as Dawn mentioned, the supply and demand issue, if you've refreshed and you've been in the waiting room for 30, 45 minutes, the chances that you're going to get through to get to a ticket are really getting slimmer and slimmer. And at this point, it might just be best for your mental health to try again the next time, because the supply and demand is just a little tough.
Yeah, because definitely that's the second part of her question. Once you're in the queue or waiting room, you've made it to the time slots, you click on one and it comes up unavailable. Do you hit back or refresh? See what you're saying, just to really close that,
so those are a little bit,
and try again.
Yeah, those are a little bit different issues. Excuse me. So if you get to the waiting room, yeah, it's definitely best to refresh it for a little while. If you've spent about 45 minutes there, maybe try again next time. If you're getting to a ticketing screen and you're able to select a date and a time and it looks like it's available and you click on it and then it says it's unavailable, again, it goes back to the 30-minute process that people have. And so say Don Walker is in the process of reserving his ticket. Technically, the system sees that the ticket is still available. Even though someone is trying to reserve it, it isn't completely reserved yet. And so the system says, hey, there's still a ticket available. But it's unavailable to me to be able to go in because Dawn is already in the process of trying to reserve that ticket. And so, like I said before, one of two things is going to happen. Either he's going to reserve it and then the ticket is gone, or it will kick him from the system, or he'll decide to back out on his own, and then that ticket becomes available again.
Okay. Another technical question from Jackie Buscemi is, does arriving before the actual sign up help? If so, I'll enter the waiting room at 4 a.m. I have a feeling, however, that whether you get the schedule screen is entirely random, and lucky folks who arrive at 6:45 were chosen instead of me.
Yeah, so I'm not sure if she's asking about our site or the public site, because I know that. Yeah. So for us, it doesn't matter if you log on 15 minutes beforehand or the same minute that it comes to your cell phone. It really doesn't make much of a difference in this case with the limited supply that we do have.
Okay.
Isadora,
yeah.
If I can just add something to it. I just want to make it clear to people, this Eventbrite site is a site that's been in place for a while. It's not a system that we created. It's a system that the county has chosen to utilize because it can accommodate 1,500 applications in a 3-minute period. unlike people trying to get on the phone when there's thousands of others and the line's busy and you're not getting through, or you're getting a ring and no one's answering. Also versus sitting in line, hoping you'll be one of the first come, first served in a long string of cars on the highway waiting to get, your chance at a few number of shots. So the system does what it's created to do. People have used Eventbrite for years to buy concert tickets and things like that. We chose that because we knew the Florida Department of Health phone line was inundated with over 88,000 calls on the first day they opened up for appointment to make appointments. We've accommodated 2,500 tickets at once. We've accommodated, I think the most was 3,500 perhaps, 1,500 again in 3 minutes. So for the amount of vaccines that are available and for the appointments that we're able to book, the system's doing what it's created to do. Unfortunately, with that system comes a waiting room. And I would tell you this from a personal level, if I got into the waiting room, I would log out, because now we've had people that have waited 2 and 4 hours thinking they were going to suddenly, there would be a ticket that appeared and they could book an appointment, and it doesn't happen. So, again, the last thing we want to do is frustrate people. Just remember that you're one of 150,000 plus, because we have people from other counties also trying to get those appointments. And if there's 1,500 vaccines and you're not given an appointment within about a 15-minute period, you're probably not going to get one. You don't want to waste your time.
Well, that's a great tip, Dawn. I'm sure a lot of people have been stuck in that waiting room for hours. So I appreciate you saying that. But I actually have a question now I believe Dave might be the best person to answer this. One of the questions we've gotten from a few people is, it seems to them that Publix is getting a lot of doses, and a lot of people who signed up through Omni, their appointments got canceled or got postponed. Dave, can you explain what's happening with Omni, and why does it seem to be a discrepancy between Omni and Publix right now? What's behind that?
Right. The Publix program is a statewide program that the governor's office has been pushing. The governor feels that Publix is a location where many people feel comfortable going because they shop at public stores, and most of the locations are within 1 to 2 miles of somebody's house. So the governor has periodically been expanding the Publix vaccination program. I believe there's 20 counties now that are part of the program. And they, including Brevard, which has 22 pharmacies and public stores that are participating in the program. The Omni vaccinations, Omni, which is a healthcare provider in Brevard County, did get an allocation of 2,000 doses that they used pretty quickly. They got a bunch of appointments set up and used those, but that was turned out to be a one-time allocation. That those doses came from another county that wasn't able to use them quickly enough, and the governor's office, working with State Representative Randy Fine, had been able to move those doses to Brevard County for use at Omni. But since then, they have not received additional allocations, and do have a number of people that they put on a waiting list. And once they get more allocations, they expect to use them for the people that are on the waiting list. But right now, those appointments have kind of pushed back until Omni gets more vaccinations in hand.
So if I can add to what Dave's saying, because I've heard this being talked about, but the vaccines that Omni gets and the vaccines that the hospitals have gotten so far are separate than what FDOH gets and Publix gets. And there's a concern in the community now from people that the governor's taken away the vaccines that were earmarked for the Florida Department of Health and given them all to Publix. And that is not correct. What's happened is, where we may have gotten 3,500 doses, Publix is getting some of those doses, and we're getting less doses, but the same number of doses that would have been received for the county overall have been received. So the great thing about Publix being involved here, as Dave mentioned, is that they're spread out throughout the county, where again, the Florida Department of Health is located centrally in Brevard County in Viera. So having Publix out there doing the vaccines means a lot of people that live out, in Mims or in Barefoot Bay or other areas where it's inconvenient to get to Viera are able to go to their local store and get the vaccine if they can get an appointment. So we're not losing vaccines, we're not missing vaccines, but instead of everyone having to come to Viera to get those vaccines that the county would have been allocated, we're diluting those somewhat, but giving them out to the Publix. So it's still the same number of vaccines, but fortunately available elsewhere in the county besides Viera.
Dave, you have any more questions before I move on?
Yeah, I want to ask when you feel that the vaccine supply might be increasing. I know it's not a decision by the county, but are you getting any indications from any changes in the federal administration or from the state that there might be a big increase in the vaccine amounts coming to individual counties in the near future?
Well, I know it's disheartening for people when they turn on the evening news and they hear that warehouses in Washington, D.C. that they thought were going to be full of vaccines are empty. So we don't know exactly, when our supplies are going to increase. The supplies we're getting now are half of what was originally promised to the state. So, so there's, a short supply in D.C., there's a less supply than we expected in the state, and therefore fewer supplies going out to the county as they disperse them around to all the counties in the state. All we can do from a county standpoint right now, and we're doing it, is we're getting the mechanisms in place that will show the governor that we have the ability, the capability, the manpower, the logistics, and the facilities to get more shots in arms if we get those supplies. I know the federal government's trying to ramp up the production of these vaccines. I know more vaccines are coming online, Johnson & Johnson, and there's another one. But, as readily as they can get to the federal government level and they can get to the state level, we're ready to get those shots in arms. We just need the vaccine.
And Don, how confident do you feel that we have the infrastructure to handle a larger supply? I know the Brevard County Commission approved partnering with our 3 hospital chains, but is Brevard ready for that influx of vaccines, or is this something like careful what you wish for?
Yeah, no, this is something that we've really been planning all along, because we know, and the governor made it very clear from the onset. Originally, he was talking about taking vaccines from hospitals that couldn't get the shots in arms quick enough. So he said if he was seeing where hospitals could get the shots in arms faster than other hospitals, he was going to take those from those hospitals that were lagging behind and get them to the hospitals that were surging ahead. So knowing that on the onset, we had already developed plans where we could use fire stations and paramedics to get those shots in arms at other sites throughout the county. We had to identify locations where people could get in and out of traffic without creating a major logjam. We've done all that. Well, then the hospitals reached out to us and they were willing to partner with us. And, people feel comfortable going to hospitals and going to their personal physicians. So we took that proposal to the commissioners and they approved it on Tuesday, that we will work with Health First to do shots in Central and South Brevard County. We'll work with Parish Hospital to do them in Central and North part of the county, and Stewart Hospital to do them in the central part of the county. I believe that's the breakdown. I apologize if I'm off on how that spread is going to work. But those are the 3 major health systems that we're going to be working with, who have already told us they would partner with us. And so we're ready for that. And we also hired a private vendor. We're ready to put one in place that if we start getting ample supplies of vaccines, they will be ready to go. And that they alone can do 5,000 vaccines in a week. And with the hospitals helping us and with FDOH continuing to do what it's doing, we're looking at ramping up our daily vaccine totals from 800 to 1,000 in a day, or 5,000 a week, to over 18 to 20,000 in a week. So we're ready to go.
You just need the doses.
Right.
Yes. By the way, we're getting some comments online. Beth says, Don, thank you for your work. Why on earth did the governor keep eligibility narrow, like following the CDC guidelines until the supply was more robust? We wish we had the governor to answer that question. Unfortunately,
Well, I know a little bit of that.
Go ahead.
Well, I mean, initially the state was promised from the federal government twice the amount of vaccine it received. And I think based on those early predictions of how much vaccine we would get, the governor decided that instead of 75 and older, he would drop it to 65 and older. One can only assume the governor was trying to help as many people as he could possibly help. But what happened is then the federal government overpromised, and the state ended up receiving half of the allocations it thought it was going to receive. And so that's where the first problem began. And that's why, people are complaining, well, why 65 and older when it's the older population that are, more susceptible and more in danger? Early promises didn't come through. But, what we're seeing, though, is that the people who are testing positive today for COVID are people that are 45 and older. So, I don't know that the governor, was too overzealous, but, it is what it is. It's 65 and older. It doesn't narrow it down to 65 with comorbidities and older, or 65. And, because I've had people call me and say, well, there's some 65-year-olds who are like 45 because they're so healthy. But then there's other 65-year-olds that have kidney disease, et cetera. Why couldn't they have done it like that? I don't know how you separate and segment those out of the population of people who are 65 and older.
I can only imagine, if it's confusing as it is, imagine if you had that added requirement of having people prove that they have a pre-existing condition.
Right.
I think it's best to leave it as it is, given the current state of things. But also one interesting question from Beth as well is, why aren't county residents given priority? Because we know that even Brevard County residents have been traveling to other parts of the state. I mean, how does that work? I mean, could Brevard County even do that if they wanted to?
Okay, well, I can answer that too. I mean, it's the governor's executive order that sets the parameters of how this vaccine program is going to work. It's a federal program, however. So, initially when they first began doing these vaccines, you could be from anywhere. I was getting a lot of complaints from people from Canada were here getting our vaccines. Well, it's a federal program. So, you can't not allow people, if they can get an appointment and they fit the eligibility requirements, 65 and older, healthcare worker with direct patient contact who isn't working with the hospital system. If they met the eligibility, that's all was required. The governor took another look at it here a week or so ago and decided, well, let's make a residency requirement. You must live in Florida to get the vaccine. But I know a lot of people that live in other counties are reaching out to us for appointments. I know other people elsewhere in the state who have gone to other counties and received the vaccine. Until the governor changes the executive order, those are the rules in place right now.
And also with that, the governor has said that part-time residents of Florida can sign up for the vaccine, even if they officially live in another state part of the year, as long as they can show they have a residence here and can show through a utility bill or rent payment or mortgage payment that they do live here part of the year. So because they're living here now, the governor feels that they should be allowed to get a vaccine in Florida.
Yeah, that's absolutely correct. And thanks for the correction on that, or the clarification on that, Dave. But that is correct.
And Don, something that I'm seeing in other parts of Central Florida, they're setting up vaccine pods at retirement communities. I believe there's one in Kissimmee, there's one in Hillsborough, where it's a pod that's only available for residents of that community. Is that something that could happen in Brevard? Because I know we have quite a few of those here locally.
Yeah, so that's another thing that's done through the state. But as an example, just a couple of Saturdays ago, we did one of those at Mount Moriah Church down in Palm Bay, and we gave out we did over 500 vaccines that day. And we also have others planned elsewhere in the county. as we move forward. So there will be others that'll be coming up here in the days and weeks ahead. We have already determined where we want to do those, but we don't want to promise anything until we have the vaccines in hand. But as we continue to get additional vaccines in hand, we definitely plan beyond the hospitals and the private contractor to branch out as far and wide in the county as we can. We know there's people who don't have access to transportation. We know there are people who don't have access to computers. We know there are shut-ins. We know there are underserved communities. We are not blind to that. We are not oblivious to the fact that there are people that can't get to us that need the vaccine, and we're going to be working, diligently as those vaccines become more plentiful to reach those folks. And whether we're sending out people in caravans to hit certain neighborhoods or whatever, I mean, all that will be determined, but we need to see the vaccines coming in first.
All right, so we're reaching, I think, Dave, any more questions? I think we're reaching close to 35 minutes here.
One more question for Don or Jesse is whether the sense is that the second dose of the vaccines, the health department does feel that they have the adequate second doses of the vaccines for the people that do have gotten the first dose already, that supply is still in line to come to the county. Is that correct?
Yeah, so Maria Stahl, who is the administrator of the Department of Health Brevard, she was on our Facebook Live event today, and we answered a lot of questions, and that was one of them. And according to Maria, the state plans to deliver on those second doses. We have second doses in hand here in Brevard County. We have already started second doses for people. We've done 40,099 vaccines in Brevard County, and 33,404 of those are first dose. So we have already started giving people their second doses. The second dose is exactly the same vaccine as the first dose. So we have those vaccines in hand. People are asking, well, why don't you go ahead and use those second doses to give first doses to the people that haven't received their doses yet? Well, that's another governor thing. Until he dictates that second doses are going to become first doses, we feel like, we're going to follow through on the appointments that we've set up for people to get those second doses, and we're going to provide those second doses. And we have the supplies in hand.
And Don, I know you kind of spoke about this already, but we just got a question on Facebook from Bud. Going forward, based on realistic schedules, how many vaccines is the county planning to receive and when? I know we don't have an answer, but for those who just joined, just to clarify what we know and what we don't know about that.
Yeah, I mean, it would be pure speculation. We've seen it rise and fall week to week. And with Publix as part of the equation now, it's hard to say. We'll know Friday, Saturday, what our doses are going to be for next week, and we'll start planning from there when and how we're going to announce those appointments coming online for people to go and book. But, I don't want to speculate, because if I said, well, we'd love to have 10,000 doses, and we would, but do you think we're going to jump from 1,500 doses this past Monday to 10,000? I would hope so, but I don't see that happening. So I'm just hoping that, as long as, because we ran out of the supplies of the doses on Wednesday. So we have nobody getting vaccines Thursday and Friday, today and tomorrow. I'm just hoping that by Monday, or at least Tuesday and Wednesday of next week, we're back to giving out more doses. So at this point, I'll be anxious to hear how many doses we get, but it'd be pure guesswork on my part, and I'm afraid that either I'd let people down or make people overexcited. So I don't know.
And I'm getting a question here from Denise, and then she actually emailed me that question, so I think she really wants to know the answer. But the question is, does the time and date stamp associated with the event picture on Eventbrite have any relationship to when the appointment window opens? I'm not sure I understand the question, so maybe.
Yeah, I have an idea. I know what she's asking, but I'm going to let Jesse respond to this question because she's more of the expert on this.
So if I'm assuming the question that I think she's asking, so when you go onto Eventbrite, yes, you're going to see that we have an event that starts at 9 a.m. and it's from 9 a.m. to 9:15. Well, what that is those are the events, those are the appointments that people have booked. And so you're going to be able to see that that event is still happening, just as if it was a concert. You're going to see that our concert starts at this time, this date. But that doesn't necessarily mean that more appointments are open. That's just when people made those reservations. If that's the question that she's asking.
Yeah.
Dawn,
is that what she's asking? If the DOH always sends a text message when the appointment window opens, which is a good chance for us to remind people what the text alert is and what they should be texting.
Yeah, so
Right.
Well, to clarify that, it's not the FDOH that sends that alert. It's Brevard County Emergency Management.
Right.
And yes, that's one way we let everybody know that signed up for text alerts that there are appointments available. We've also used press releases and we've posted it on social media. We found a couple kinks in that system because the computer can only spit out so many press releases at once. And so we discovered on Monday that people didn't receive the release we sent out at 11 o'clock until 2 and 4 o'clock that afternoon. Well, the appointments were booked up in 3 to 11 minutes. So we're working on a way to make sure that doesn't happen again, because we don't want to frustrate people, but when we discover that we are, well, then we're going to clean up that process as soon as possible. Text alerts are the quickest, best way to know that we're about to open appointments. We give people a little bit of a heads up. We have people waiting on the phone for 2 hours for an appointment, so we text when we know we're going to activate the system. And again, to get that text on your phone, you create a text to 888-777, and in the text area where you would write me a note, you write Brevard EOC, and you send that, and then you'll get a response that your alert is, you'll get a notification that you've been signed up.
And any idea, Dawn, when phase 2, I know we're talking about lack of supply for phase 1, which includes people over the age of 65 and healthcare workers, but a lot of people who are not 65 are anxiously waiting. Any talk in the county? Have you heard any buzz about this? When would the next phase begin?
Yeah, I mean, again, I can't even begin to speculate. I mean, initially the federal government was saying that, they would start getting shots in arms, hopefully late spring, early summer, maybe even into fall. So the good news is we're doing vaccines now. So, I try to, not focus on the valleys, but kind of look at the peaks. So the good news is there are 40,000 people in Brevard County that have received the vaccine. We have 600,000 residents of Brevard County. And we weren't even sure what the interest would be, that people might want not to get the vaccine. The good news is people want the vaccine. So we need it. We want to get it out there. And when, as the supplies come in, we're going to do our due diligence to get as many shots in arms as possible to as many folks as possible.
Do you ever have any no-shows?
We do book shows, and we've had people call that want to change their second shot appointment. But, the demand is so high, we can't move appointments around. We don't have the manpower in place to work appointment lines and, move appointments around and things like that. So I'm afraid to say that if you've gotten your first vaccine and you can't get there on the date that your second dose is due, you may miss out on your second dose. It's not a guarantee.
Yes, and where did those doses go when somebody doesn't show up for their appointment?
Well, that would just be added to the inventory.
To
so
the next one.
Coming down the road later on that may not have had one will get one.
Okay, if you're booking a vaccine and you don't show up, I don't know what to tell you.
Well, no.
Just show up if you book it.
But here's what happens though. People might have booked a vaccine with us,
And got somewhere else.
With luck, they were able to snag a vaccine at a Publix in Palm Bay, and that's where they live. So it's not surprising for people not to show up. And we've had a lot of people show up who don't have an appointment, and unfortunately, we have to turn them around and send them back home. So it kind of goes both ways. But yeah, if you've made an appointment with us, consider yourself very fortunate that you were able to get one of those, because obviously there's a lot of people waiting in line behind you. And hopefully if you can't make that appointment or you snag another one somewhere else, it will, Jesse, correct me if I'm wrong, but if an appointment is created because someone canceled, I think you might win the lottery kind of a thing where you can find that appointment on Eventbrite and still snag it.
Yeah, so as long as we have not made the Eventbrite sold out, or as long as for that URL that we created, like the first one we did for January 5th through the 18th or whatever. So obviously if the date has already passed, there's no use. But yes, if you are lucky enough to find a canceled appointment and it's not sold out and it's not past the date, then yeah, you can snag an appointment that way for sure.
Yeah, so Haley's saying I would like to call and find out at the end of the day if there's anything left. I would jump in the car and get it. That seems like that would be hard to. You can't just call. By the way, this is a good time to remind people that the best way to know when vaccine slots will be open is to text the word Brevard EOC. That's Elephant Otter Cat. The number 888-777. There is no number to call right now. Am I correct?
That's correct.
There is no number, so I know there's confusion. The state is currently working on a system that will incorporate a phone system and a web-based system, but right now everything is done online. So make sure if you have a smartphone, if you don't have one, ask a friend or family member who does and ask them to text Brevard EOC to 888-777. And I think that's it. Is there anything else that you guys want to say before we wrap up?
So
Go ahead, Jesse, and I've got something I want to add.
Sorry, I did see that there was a question about how many tickets that you can get at one time on Eventbrite, and we have set it up so that you can reserve up to 2 tickets at a time. So for you and your spouse to be able to get vaccinated, but you can only reserve up to 2 tickets at a time.
Great.
And I was going to say that we were told today that we've had almost 30,000 cases of COVID in Brevard County. This is still an ongoing pandemic, and I know it's boring. You've heard it before 1,000 times, but I just want to stress again, your best self-defense right now for COVID-19 is to wear a mask, to social distance, and to stay at home if you're sick. Anything that you can do to protect yourself and others, I would highly encourage you to continue to do so. Even if you've had the first dose, even if you've gotten the second dose, until we know, that we've got a handle on this pandemic, I would continue to follow the CDC recommendations.
Yes, and testing in Brevard County is free of charge, by the way. They're not doing it at the Viera office anymore. You have to drive to the Palm Bay Eastern Florida State College campus, right? It's no appointment required.
Correct.
And it's the drive-through testing facility. We're talking about testing now, not vaccine. So don't show up there trying to get a vaccine. But it's important for people to know as well that they can get tested for free. And it's important for you to do. I did it, and I was negative, but I got it in less than, I think, 48 hours. The test, I downloaded the app, and I got the results back much more quickly than I ever anticipated. So that was good. It doesn't hurt. They don't put the swab in your nose anymore. They just put it in your throat, at least when I was there. So always good to get that information out. Dawn and Jesse, thank you so much for answering all of our questions, and Dave as well for sharing your knowledge. And I want to thank everybody who sent me questions via email. I probably didn't get to all of them, but we appreciate your interest in supporting Florida Today, and hope everybody gets the vaccine in time.
Thank you, Isadora.
All right, thank you.
Thank you.